Hello and welcome to the 2014 Medical Treatment Guidelines Protocol Training. This is Module 1, which is an introduction module to your protocol training. This training was developed by the Fauquier County Department of Fire Rescue and Emergency Management Training Division, Lieutenant Matthew Shields and Lieutenant Mary Hart. We encourage you to follow along in your protocol book during this training. Some of the objectives of this training, things we're going to talk about. First, we're going to disprove some fallacies. There's a few things out there that providers may have think about these protocols or they may have heard. We're just going to make sure everybody's on the same page. Next, we're going to explain the scope of practice legend. This is really the foundation of how to follow these protocols and to maintain treatment within your specific scope of practice. We're going to talk about concept mapping or a flowchart style of protocols. This may be new to many providers. We're also going to explain how to navigate the protocol manual. We're going to do this by telling you all of the new medications new to Fauquier County. We won't be mentioning every medication within these protocols until we get to the specific module for your provider level. Let's start with disproving some fallacies. Many of us heard this statement: why are we using protocols from West Virginia? This is false. These protocols were obtained with permission from the Western Virginia EMS Council, which is located in Roanoke. They've been modified by the Fauquier County EMS Committee, and Dr. Michael Jinks has approved them. Another statement you may have heard, protocols exceed the EMT scope of practice. This is false as well. These protocols have been verified several times over not to exceed practice maximums for any level of EMS provider in accordance with the Virginia Office of EMS. You can find these scope of practice levels online on OEMS's website, and they're titled the Scope of Practice Procedures and Scope of Practice Formularies. Okay, let's take a look at the scope of practice legend. You can find this on page 4 of the protocol book. The provider level is divided into 4 categories, and you can find your level in one of these 4 categories is a colored box with a letter. The EMT and basic EMT is the yellow box with an E. The EMT enhanced and advanced EMT is the green box with an A. The EMT intermediate is the blue box with an I, and the EMT paramedic and paramedic is the purple box with the P. What this will do will help you as a provider stay within your level and not to exceed your scope of practice when treating a patient. Let's take a look at this protocol. This is protocol number 2, actually, and we've just put this up here because we're going to discuss flowchart protocols, what all these shapes mean, how we actually use our provider indicator from the scope of practice legend, and where we start our treatment and where we stop our treatment. So flowchart. Many of us are not familiar with flowcharts. However, they do have benefits. They're visually stimulating. They're nicely laid out. And they also gain and hold the reader's attention better than a block of text. However, these shapes in the flowchart do mean something. We need to understand what they mean. It'll help guide our decisions. For example, the diamond is a decision point. Usually the answer is in the form of yes or no. Scene safe, yes or no. The square or rectangle is a treatment or action, medication dosage, or a specific action such as perform a head tilt chin lift, administer oxygen. And the oval guides the provider to exit the current protocol and go to the appropriate protocol. Okay, let's take a look at the table of contents within the protocols. Your patient complaint or chief complaint is broken down categorically into these subcategories: general, airway, cardiac arrest, environmental, injury, medical OBGYN, and weapons of mass destruction. After the protocol section, we go into the skills procedures section, which we're not going to focus on much in this training. You will receive that during the skills portion of the entire protocol course. There's a policy section which you are responsible for becoming very familiar with, a medication reference section, and an EMS reference section. Okay, so now we're going to start with the section titled General. Our first protocol, protocol number 1, is a universal patient care initial patient contact protocol. This is a flowchart for decision making between medical and trauma patients, whether it is a significant mechanism of injury or an insignificant mechanism of injury, and for the medical patient, whether they are responsive or unresponsive. As you notice at the very bottom of this protocol, there are several ovals which exit to the appropriate protocol. Protocol number 2 is our behavioral patient restraint protocol, and for our intermediate and paramedics, we have a new medication, haloperidol or Haldol, and we also have Versed for chemical restraint indicated within this protocol. Protocol 3 is a general cardiac arrest adult protocol, and there is something new in here. It's the continuous compressions CPR. Protocol 4 is general cardiac arrest pediatric. Nothing new in that protocol. Continuous compression CPR is contraindicated in pediatric patients. Protocol 5 is an epistaxis protocol, and all providers will have a new medication, Afrin or oxymetazoline, for nosebleeds. Protocol 6 is our fever protocol, and EMT up to paramedic will be treating fever with ibuprofen and acetaminophen for adults, and enhanced through paramedic will be treating pediatric patients with the same medications, ibuprofen and acetaminophen. Protocol 7 is a pain control protocol. EMTs and enhanced advanced providers will be treating pain in adults with ibuprofen, acetaminophen, or aspirin, and our intermediate and paramedics will be treating with fentanyl, ketamine, and morphine. Protocol 8 is our pepper spray taser removal protocol, all provider levels. And we'll go over this further in our skills training. Protocol 9 is a rehabilitation for responders protocol. And Protocol 10, pictured to the right, is our spinal immobilization clearance protocol. This brings us to the airway section within the protocol. We start off with Protocol 11, which is a general airway protocol. It covers indications for all airway procedures. It discusses direct laryngoscopy for our intermediate and paramedics. It discusses blind insertion airway devices, King Airway, for all providers. It discusses intubation, airway cricothyrotomy, and needle chest decompression. Protocol 12 is our airway failed protocol, and this is the procedures for a failed airway attempt. This is defined as 2 failed attempts by the most proficient technician on scene or anatomy inconsistent with intubation attempts. Each attempt should include changes in approach or equipment and no more than 3 total attempts. This also directs the provider to go to airway cricothyrotomy or possibly the King Airway.